A patient walks into your clinic, brings his or her X-ray, and wants you to comment on it. ये क्या कर दिया? ये तो कैंसर बना दिया तुम्हारे. किससे करवाया था? किस ना समझ के पास गए थे तुम लोग? ओ माय गॉड, अब क्या करेंगे? क्या आप भी ऐसे करते हैं? Do you also comment on fellow colleagues' work in your clinic like this? Hi, I'm Dr. Bhavdeep Ahuja. I'm a dentist with 23 plus years of experience, and along with dentistry, I'm training and coaching colleagues on the topics of practice management, medical legal ethics aspect, consent, documentation, and finances in dentistry. So in today's video of mine, I am going to divulge a few things about how to inform the patient if any botched up procedure is done in his mouth or any mishap done in his mouth, or how to inform the patient without demeaning fellow dentist who had dealt with it in the past. Why do we need to inform the patient? Why do we need to tell the patient in a language which is not demeaning to colleagues, which is not derogatory for our profession? And also to tell the patient, because if you don't tell, this becomes your property. What do I mean by this becomes your property? A patient has come into your clinic with a root canal done. The patient says, I got a root canal done from ABC clinic. Please put a crown over it. And sometimes we don't even ask, don't even bother to check the post-operative X-ray. The patient says, no, I'm fine with the tooth. I don't have any pain. So don't need to, please directly go and you can say, go in for the crown and take the impression and go in for the crown. And most of us respond like, what we do, what I mean by this expression, man mein laddu phuta impression. Of course, I put it in a crude way. I'm sorry for that. But what I mean to say is we don't even bother to do that. The moment you put the crown, even if you can say the root canal is done fine or not fine, we never bother to check. The moment you put the crown, if the patient has any problem, then the root canal also becomes yours, because the patient's first expression or impression would be, Bina crown ke to it was fine. Before the crown, it was fine. It only created problem because of the crown you put in. Then you take the X-ray, you find the root canal to be faulty, and then you try to explain the patient even 1,00,000 times, the patient will not understand. So that is why it should not become your property. Now, coming back to the original topic, how do we inform? The first way in the introductory sequence that I showed you, ये क्या कर दिया? Cancer बना दिया. People have done it. People have done it even with my cases. My beloved colleagues have done it with my cases also. Mistakes do happen. We all do it. None of us is perfect. The only thing is recognize the mistake at the earliest level and try to rectify it. Because if you don't own up the mistake, the patient is bound to take a second opinion. Sometimes the patient is not patient enough to come to you and tell to you about the problem. They'll directly go to another case and seek a second opinion. So we have to understand that we have to talk about our colleagues in a very, very dignified way. Telling the problem, whenever the patient says, "Aap dekh ke bataiye, isme koi problem hai na," they try to put words in our mouth. What we have got to do via this is that we tell them mistakes do happen. शायद ये mistake मैंने भी 100 बार की होगी. Try to journalize the things without pinpointing. ऐसे तो कोई नहीं करता, ऐसे हमने तो आज तक नहीं किया. Trying to make yourself a godlike is never right in your clinic. So try to journalize things, take on that. Yes, you have also done similar mistakes, and ask the patient about the agenda. What is your agenda? If the patient says, "Doctor, I am having a lot of problem, I want to solve this problem." Number one ground rule. Okay, we'll solve your problem. But my ground rule is we shall not discuss the past. Number second situation, the patient says, Doctor, ये स्थान में problem है, आप मुझे लिख के दीजिए कोई problem है. The patient might use your written against the other dentist. Of course, you still won't be in any problem. You have just given an opinion, but that is how your opinion is counted in the court of law. You might be needing to go to give a testimony and speak against a colleague. Ethically, right or wrong is separate thing. You try to protect a colleague, you try to side a patient whom you don't know is another thing. I might sound biased towards colleagues, but yes, as a professional colleague, we have to stand by our friends, our brethren, our colleagues, our dentists first before standing with any patient. And I'm crystal clear about it. The moment the patient says, write me something against this colleague, I always say, I'm sorry, you are at the wrong door. That is the way out. It very politely. If the patient is hell-bent on making me write these things, I'm not going to write against a colleague. But yes, if we are going to solve the problem, saying mistakes are happening, I'm journalizing it, saying, let's not discuss the past. But if the patient says, ये problem है, आप इसको solve करने के पैसे लेंगे, yes. If we are solving someone's problem, we won't do it for free. We have to charge for it. So let me talk out to my original dentist who has done this. If you are going to charge, I better contact him first. You, at that point of time, before the patient reaches the dentist, you reach out. Of course, we all have each other's contacts, or otherwise you can contact the local IDA. You can get a contact of the dentist. Inform the dentist exactly about what happened. Your patient came, this is the thing, and I informed this thing. The patient might come to you. I have said these generalized things. Make yourselves ethically upright in this matter. So this is the way we deal with a situation whenever we find a botched up work. We can say very humbly saying with a lot of humility that we are not perfect. We also commit a lot of mistakes. Owning up one, solving up one is the first step. But if the patient doesn't give you even that chance to solve it and goes in for a second opinion, we at least try to say a few things which should not hurt a colleague's image. Yes, a botched work can be defined in a different way also, rather than glorifying the same. If you like this video, please do share with friends and colleagues. And please do subscribe to my channel. Thank you so much. And I shall be back with another of my video very soon. Bye-bye. Take care.